Good afternoon, everyone, and welcome to our Lunch and Learn presentation on smoking and asthma, put on by the Chicago Asthma Consortium. Thank you all for being here and for participating in this presentation today. Um, I'm Matt Seymour. I'm the president of the Chicago Asthma Consortium and the executive director of Mobile Care Chicago. I'll be moderating the presentation today, so you might see me put a couple of things in the chat. And of course, if you have any questions throughout the presentation, you can always chat them to me, and I'll make sure that those are shared out after the presentation is over. So today's schedule, we're going to do a brief welcome and a speaker introduction, and then I'll welcome Rebecca Padilla, who is going to share her presentation with us. We'll do a brief Q&A afterward, and we'll talk about that in a second, and then we'll close at 12:30 or thereabouts. As a couple of housekeeping items, video and audio should be off during the presentation. That's just so that we can keep everything moving. If you do have any sort of concerns, you can put those into the chat. If you have any questions, you can put them in there as well. If you want to introduce yourself, we would love to know who is attending the presentation, and very happy to chat during the presentation. If you have questions for the presenter as we go along, just put those into the chat and I'll take all of the questions out, and then I'll make sure that Rebecca has an opportunity to answer your question after the presentation is over. And then we'll also ask everyone to do a brief evaluation at the end, just so that, if there are other topics that you would like to see, or other things that we need to be aware of that we can improve, we have all of that information and we can make sure that we're doing presentations that are valuable to you. A little bit about the CAC. So we've been around for 25 years now. The mission of the CAC is to provide quality of life improvements for people with asthma through advocacy, education, and collaboration. And essentially the way that we do that is that we convene medical and public health professionals, business leaders, government agencies, community-based organizations, and individuals dedicated to raising awareness of asthma and improving the quality of life for people living with asthma. You can look at more about the Chicago Asthma Consortium on our website, chicagoasthma.org. We do take volunteers to help us out all the time. We have a number of committees that are doing this work on a sort of like week-to-week, month-to-month basis. And all of those committees are volunteer-led and volunteer-supported. So we have a community advisory board that allows people who are doing asthma research to sort of bring their ideas to the community so that they can formulate effective strategies and make sure that their research is as ethical as possible and as transparent as possible. We have a community engagement committee that's doing asthma education out in the field and trying to make sure that guidelines-based asthma care is well known to people who suffer from asthma, and also primary care providers and other health professionals who are treating people with asthma. We have a fundraising committee that helps us to support the infrastructure that we're using today. We have a membership committee that is in charge of keeping up with our members of CAC and making sure that over the course of the year they have chances to network and get to know each other. We have a professional development committee that puts on webinars like the one that we're doing today, as well as 2 conferences each year. And then we have a schools committee that's specifically focused on supporting children who have asthma and the school environments in which they are, spending their days. We are accepting board applications. The board of directors is a group of volunteers. Most of us have asthma or work in the field of asthma. We're very passionate about making sure that people with asthma have access to the resources that they need. So if you are interested in joining the board of directors, we would love to have you there. You can go to our website where we have the criteria of, board of directors members. And you can also join any of our various committees, and we would be very happy to have you. Um, Today's presenter is Rebecca Padilla, National Senior Manager of Tobacco Programs at the American Lung Association, and I'll give a brief introduction to Rebecca. We're very happy to have her here, and thank you, Rebecca, for sharing your time and your experience. Rebecca serves, as I said, as the National Senior Manager for Tobacco Programs at the American Lung Association. She manages a national project that offers technical assistance to state, territorial, and local tobacco control programs, health systems, and community partners to further health systems change efforts and to integrate evidence-based tobacco use dependency treatment in clinical and community health settings as part of a multi-year cooperative agreement with the CDC. Rebecca has lived through with severe asthma and has lost family members to commercial tobacco use. And it's her life's mission to inspire change, fuel progress, and champion healthier tomorrows one breath at a time. So thank you, Rebecca, for being here, and I'll pass it over to you to share your presentation.
Thank you so much, Matt. I'm really, really happy and excited to be chatting with everyone today. As Matt mentioned, this is a topic that is very near and dear to my heart and lungs, of course. I have had severe asthma my entire life, and it was absolutely exacerbated by commercial tobacco use in my home that I grew up in. I do want to let everyone know really quickly, you're going to see QR codes throughout the presentation today. So don't be afraid to grab your phone, scan that QR code. The very first one that's on the screen is going to give you a PDF copy of all the slides that I'm sharing with you today. So you can refer back to them, share them with a coworker or a friend or someone that might benefit from it. So I am a certified tobacco treatment specialist. And I do want to make a note really quickly before we get too much into our presentation today, that all references to tobacco and tobacco products within this presentation refer specifically to commercial tobacco and nicotine-containing products, and not the tobacco or other plant mixtures that are grown, harvested, and used by American Indians and some indigenous people for sacred purposes. So we have a lot to talk about today in a very brief amount of time, but I do want to remind everyone that for almost 120 years, people have trusted us at the American Lung Association to protect their lungs, whether it's researching treatments and cures for lung disease, keeping kids off of tobacco products, including e-cigarettes, or advocating for laws that protect the air we breathe. And our vision is really a world free of lung disease. So with this, our goals are really big ones. We want to defeat lung cancer. We want to champion clean air for all. We want to improve the quality of life for those with lung disease and their families. And we want to create a commercial tobacco-free future. So we're going to get to cover all of these topics today. And, I'm going to share some resources about how you as a volunteer with the Chicago Asthma Consortium or a potential volunteer can help to address some of these key important strategic imperatives. So really quickly, today's agenda, we're going to cover asthma, specifically childhood asthma, tobacco product use, smoke and aerosol exposure, and some key strategies and supports. So again, I have that QR code. If you didn't have a chance to scan it yet, you'll have several times to during today's presentation, so you can get a hold of these slides if you'd like them. So asthma is a leading chronic illness among children and adolescents in the United States. Many of us on the call today know that. So it's also one of the leading causes of school absenteeism. And on average, in a classroom of 30 children, about 3 are likely to have asthma. Of course, some population groups are more impacted by this, especially low-income folks, some priority population groups that include specific ethnic groups, and children that live in high-density areas like inner cities, like the Chicago area, tend to have more frequent emergency department visits, hospitalizations, and at times even death due to asthma, and this is increased more so than the general population. So as I mentioned, asthma is a serious chronic lung disease, and it causes continual airway inflammation with episodes or attacks of increased inflammation or swelling. There's no cure for asthma, but there are effective medications to help control it. And of course, one of the biggest things that we can advocate for patients or family members that have asthma is to help minimize and control environmental triggers. So that can be a huge issue for children with asthma in particular. So on the screen right now, I have some stats for you. So in 2019, an estimated 189,000 Illinois children had a current asthma diagnosis. And nationally, as many as 80% of children with asthma developed symptoms before the age of 5. Asthma can be very hard to diagnose for those younger kiddos. And children that are under 5 years of age are more likely to have more frequent or more severe exacerbations. And asthma, again, is one of the main reasons children miss school or are admitted to the hospital. So there's so many things that can cause asthma symptoms or attacks. The pets we love, the air quality, but there's two important triggers that I'm going to address today for you, and that's exposure to smoke and aerosols. So let's talk first things first. Let's talk about first, second, and third hand smoke and aerosol exposure. So exposure to these aerosols and smoke residues can occur anywhere. I'm sure if anyone has walked down the street in downtown Chicago, you have seen, smelled, or experienced inhaling secondhand smoke. There are clean air laws that are in place all over the country, but exposures can still happen. And oftentimes for children with asthma, these exposures happen right inside their home. So just to do a little bit of level setting, that firsthand exposure is the active smoking or vaping. That's the person that's using the tobacco product, inhaling the smoke or aerosol into their lungs. That's firsthand. Secondhand, many of us, of course, like I just mentioned, have been exposed to secondhand smoke over the course of our life. And secondhand smoke is the exhaled smoke from the person that's using that tobacco product or that exhaled aerosol from e-cigarettes, or it's coming off the side stream of the cigarette. So there's two routes for secondhand smoke. So again, it's the exhalation of the smoke or the side stream of the smoke. So the side stream smoke is that burning end of a cigarette, a cigar, a cigarillo, a pipe, or the some vape devices have aerosol that may trickle out on the side as well. But with those combustible tobacco products, approximately 85% of that smoke that's released to the air from a tobacco product is that side stream smoke. And the remainder is that mainstream smoke that's inhaled by the user. So although mainstream and side stream smoke are very similar, the unfiltered side stream smoke actually burns at a lower temperature and consequently contains much higher concentrations of many of the toxic substances that we know are in commercial tobacco smoke. And this is how we get third-hand smoke. So there's lots of great data and evidence and research that's happening around the impact of third-hand smoke. I'm happy to share some of those resources with you if you'd like to give me an email after the presentation today. But that third-hand smoke, it's heavy. The particulates in it settle over time, and it's especially impactful for those kiddos that may be low to the ground, even our pets that are walking around on carpet or flooring. So this third-hand smoke exposure can really be consequential to little people that are inhaling that residue. They might get it into their skin. They might ingest it orally by, touching their hands or their feet. And there's lots of ways that this can really impact their health. And according to the Mayo Clinic, Infants and young people who have increased exposure to third-hand smoke due to their tendency to put objects in their mouth and unknowingly touch affected surfaces can really cause harm to themselves by ingesting all of those toxic chemicals. One of the biggest misconceptions about third-hand smoke and second-hand smoke is that simply airing out a room will take care of it, and that's absolutely not true. So many of you may have, again, exposure to secondhand smoke is linked to increased asthma symptoms. It can decrease lung function, and it can cause a greater use of health services among those who have asthma. One of the key messages for folks that may use tobacco products is that quitting is absolutely the best thing that they can do, whether that's for their own personal health or for the people in their lives that have asthma and are being impacted by their secondhand smoke. And providing smoking cessation supports is a key strategy here when we're talking to anyone about tobacco product use. So I'm going to share some resources with you in a few minutes about how you can help provide those cessation supports to people you might encounter that would benefit from it. So third-hand smoke, I thought this was really a great visual. I hope it's not too blurry on your side. Some of us, especially those of us that have cleaned out a loved one's house after they have unfortunately succumbed to many of the diseases that tobacco smoke can cause, have seen things like this on the wall. This is a great example of third-hand smoke. All of that yellowing, that residue, is an accumulation of nicotine and all of the other chemicals that are found in tobacco smoke. The Surgeon General's office also concluded that separating smokers from non-smokers or cleaning the air, ventilating buildings, absolutely cannot fully eliminate the exposure to secondhand smoke. And this is really also supported by the fact that air cleaning systems remove large particulates, but not necessarily the small and the ultrafine particulates that are found in cigarette smoke and especially found in vape aerosol. So when it comes down to it right now, the technology just doesn't match up and ventilation systems do not clear all of these particles. So really quickly, again, to reiterate, active smoking, so that's that firsthand smoke, the impact of it on folks with asthma, they're more likely to have frequent exacerbations or those increases in severity of asthma episodes. They're more likely to visit the emergency department, and they're more likely to be hospitalized. The therapeutic response to corticosteroids is impaired, and many of us that work in asthma control know that those corticoid steroids are one of the really primary lines of medication treatment for folks that have asthma or that have, lung function issues or a virus, something that causes inflammation in the lungs. Additionally, that firsthand smoke exposure increases the risk of developing worsening fixed airway obstructions and can increase all of the other chronic diseases that are associated with commercial tobacco product use. That's things like cancer, heart disease, GERD, and chronic sinusitis. So the passive tobacco smoking, that's secondhand, thirdhand smoke and asthma, this especially is impactful to young people. So on the screen, you'll see some of the primary impacts of that secondhand smoke exposure. So children with asthma that are exposed to secondhand smoke have an increased risk of having increased respiratory infections, and even children that don't have a current asthma diagnosis are more likely to be at an increased risk of developing asthma later in life. It's implicated also in some cases of new onset adult asthma, in particular in people that identify as women. Non-smoking asthmatics also have an increased risk for asthma symptoms and those exacerbations or increased risk of more episodes. Frequent exposure to passive or secondhand smoke can also increase the risk of developing COPD and other smoke-related diseases, even though the person might not be that active firsthand smoker. And the use of e-cigarettes or vaping devices, as many of us know, amongst young people is just incredibly scary. It's detrimental. And at the American Lung Association, we are doing everything we can to ensure that young people won't have to impair their health with these harmful tobacco products. So as reported from the National Youth Tobacco Survey in the 2021 American Lung Association State of Tobacco Control Report, there's some really alarming trends amongst flavored tobacco use, disposable products, vaping devices. You can see some of those on the screen today. Again, I'll share all of these resources with you so you can refer back to them later. But if you look at that middle section, you'll see that e-cigarette use really skyrocketed amongst high school and middle school students. And some of these devices are targeted right towards our young people that have asthma and carry around controller medications. I'm not sure if any of you have seen any of these devices, but they're really disturbing. To know that someone, you know, might be trying to pass off a tobacco product as a potentially life-saving medication. So we do have some really great national strategies and key focus areas that we're looking at and that I'm going to share with you today as a way to make sure that we're doing some really impactful systems level change for folks that have asthma and for folks that use commercial tobacco products. So we are here to help everyone at every level, whether it's nationally, whether it's at the system level, or at the community level, or at the individual level. So on the screen today, we have some really great tools through the project that I manage. You're welcome to scan that QR code to learn more about the health system cessation integration tools that we offer at no cost at the Lung Association. And I also want to highlight two really great initiatives from the CDC National Asthma Control Project. So the first one is CAC, which stands for Controlling Childhood Asthma, Reducing Emergencies. And the real overarching goal for this is to prevent 500,000 or 500,000 emergency department visits and hospitalizations due to asthma by August 31st, 2024. So we need your help to get those numbers down. So please scan that QR code when you have a moment, learn a little bit about what the CDC is doing with CAC. And one of the ways that they are helping to reduce all of those emergency department visits is through the Exhale package. So the Exhale package is a great technical package for folks that are in health systems or providing direct care to learn about how they can help people with asthma breathe a little better. So again, you can scan the QR code underneath the box there to learn more about the CDC Exhale Technical Package. Now that Exhale Technical Package is an acronym and it's got some key strategies. And I'm very proud to say that the American Lung Association offers a comprehensive approach to asthma using all of these strategies. And we've been doing this for years. We are the pros at it. So if any of these spark some interest in you, please feel free to reach out to us. We can give you more resources or talk to you about how you can improve quality care in the health system you work in. So as you can see, each letter stands for a different strategy. The one obviously we're most talking about today is that X for extinguishing smoking and secondhand smoke. So thinking about how we do this, again, a lot of times when we're addressing childhood asthma, it goes back to engaging and encouraging caregivers. So I have a few questions on the screen here, just some food for thought. We have just a couple more minutes left, but think about how you might respond to these. How might you say to a parent who shares that they're cutting back on smoking? How would you encourage them? If you're not quite sure, I have some tools for you. So we have some really great trainings at the American Lung Association at no cost. You can scan the QR code to land on our main lung.training page. And we have some really great trainings for folks in the community, for healthcare professionals, and great trainings to really help people quit. So if you don't know how to encourage that parent or that caregiver that's thinking about cutting back or thinking about quitting, this is definitely the training for you. We also have lots of education and awareness tools on our website. And we even have online support communities for folks that might be trying to quit smoking or trying to quit vaping and need some peer-to-peer support. We also have other online support communities for a myriad of chronic lung diseases, including asthma. And we always are here to support folks that want to give us a call at our lung helpline and tobacco quit line. We're proud to be part of the Illinois State Quit Line as well. So definitely reach out to our helpline folks. They're all amazing professionals that are respiratory therapists or nurses, certified tobacco treatment specialists, and they can answer all of your questions, whether it's about quitting or about asthma or both. And finally, we're always here to support you. There's my contact information. You can reach out to me directly. You can reach out to my team at freedomfromsmokingatlung.org. We are always happy to help you. If we're not the right folks for the job, we'll get you to the right person to support you. So with that, I know we're down to the wire. Matt, I will turn things back over to you if that's okay.
Perfect. And thank you so much, Rebecca, for such a detailed presentation. I know that trying to fit that much information into like 30 minutes is not easy. So thank you so much. Um, you know, I'll invite everyone again to, if you have any questions, put them in the chat and I'll make sure to share them out with Rebecca. I have a couple quick things that were on my list as I listened to your presentation. And Rebecca, I noticed in the people who are participating here, there's a lot of folks who are trying to support people out in the community, either through home environment assessments or through other sort of like community health worker interventions. And they're having some difficult conversations with parents about smoking tobacco. And they're also trying to sort of navigate that conversation along with conversations around, you know, um, people who are trying to quit harder drugs or people who are trying to essentially like use tobacco as like as a medication for anxiety or stress. Um, and they're trying to sort of like get people to understand the realities that you presented while also acknowledging that in their life there are very difficult circumstances that they're trying to navigate through. So I just wonder if you have any sort of like advice or any sort of like words of wisdom for folks who are doing home environment assessments and other sort of like community interventions.
Absolutely. And I'd be happy to direct you all to a great resource that my team and I developed a couple of years ago on this exact topic. And that's addressing tobacco treatment in behavioral health settings, whether it's for folks that have serious mental illness or for folks that have substance use disorder treatment or a co-occurring diagnosis. We do a lot of this work in our systems change project. So we have an entire toolkit, including trainings, resources, all at no cost to help support folks, especially community health workers that are having those difficult conversations. And one of the most important things is to understand that nicotine use dependency is a substance use disorder. And we have firm data, we have lots of evidence to support better outcomes when folks receive treatment for all co-occurring substance use disorders. So that includes those folks that are, a lot of folks that have substance use disorders are polysubstance users. So they're using multiple hard drugs. They might be using alcohol. They're using nicotine. They're using marijuana and a combination thereof. We know that there's better outcomes when they use medication-assisted treatment and counseling for all co-occurring substance use disorders. We do have that really big comprehensive toolkit. I have an hour-long webcast on our website as well that will walk you through that toolkit and some of the key points in it. And please, if you're watching today, you're one of those community health workers, I want to support you in the work you're doing. Please reach out to me, rebecca.padilla@lung.org, or you can reach out to Matt and his team at the Chicago Asthma Consortium, and they'll loop you back to me. We would love to support you in your work.
Absolutely. Thank you. And I also just wanted to briefly ask about e-cigarettes because I feel like it's kind of the elephant in the room in this conversation. And, I think for a long time, the marketing was about transitioning people off of tobacco by using these sort of like e-cigarettes as a like temporary fix or something like that. And of course, the research now suggests that that doesn't replace commercial tobacco, and in fact, carries a whole host of other sort of like medical implications for even attempting to do one or both of those. So I wondered if you wanted to talk a little bit more about e-cigarette use and its relationship to tobacco, and sort of like the health implications of e-cigarettes as well.
Sure. So e-cigarettes are tobacco products. The same folks that are selling cigarettes and cigars and cigarillos and pipe tobacco are the same companies that are selling e-cigarettes and vaping devices. They are tobacco products. This is all big tobacco. So that's the biggest lie that they have put out into our communities in the last 10 years. They are not healthier. They sustain and extend and deepen the dependency on nicotine. Oftentimes, the nicotine within these devices are at higher concentrations than they are in the combustible products. And oftentimes, folks don't know how often they're even using their vaping device. People that smoke know very clearly how many cigarettes they're smoking a day because there is a distinct ritual to it. They pull the cigarette out, they, light it up. Oftentimes they have to go outside to use it. People that use vape devices are often heavier users of that device, of that tobacco product, because oftentimes they've been lied to and marketed to that it's somehow different or better, and it's not. So they're often, hitting their vape device hundreds of times a day, if not hundreds of times within the span of an hour or two. So heavy users is what we often see there. We also see dual use consumption. So that means folks that are using an e-cigarette or a vaping device and another tobacco product, whether it's smokeless tobacco like dip or chew, or it's one of those combustible tobacco products. And again, that's compounding the impact of the dependency and the health impacts of what that dependency causes. So the best thing that we can do is get folks to quit and not switch. And we have a specific training that folks can access, again, at no cost on lung.training. And it's literally called Quit, Don't Switch. So it gives some really practical language that can be used to educate folks on why switching isn't quitting and how they can recover using FDA-approved quit medications if that's the right fit for them, depending on what their care provider determines, and or using cessation counseling. We know the combination of the two for folks that can take those FDA quit medications, that's the best combination. So really important that we talk to folks at all levels, whether it's young people, not so young people about the risks and the unknowns as well that we have yet to see with long-term use of these tobacco products.
Thank you. And we have a couple more questions in the chat. If you've just got like a few more minutes. Um,
Sure.
One, and I know there are people who are directly working in high school settings, and so one important question that was asked is there any program aimed at students in schools to provide information about the harm caused by e-cigarettes?
Absolutely. We have lots of those. So we have our newest training is called ACT, and it's specific for anyone that might be working with young people. So whether you're a coach, a parent, a community member, a volunteer, a provider, a social worker, it's a brief 1-hour training to advise, counsel, and get young people towards treatment if they're using vaping devices. Also, we have NOT, which stands for Not on Tobacco. It addresses both combustible products and vaping devices. We have several different formats for that. We have facilitated programming. We also have a self-paced online programming for young people to access themselves. There's also quit lines that have specific tailored programs for young people and for people that use vapes and want to quit. We have so much education on our website. You can go to lung.org and click on the quit smoking section, and it'll take you to tons of resources. You can also scan the QR code in my slides from today, and it'll take you directly to there. We have an entire section that's dedicated to youth.
Perfect. And Rebecca, I think there's one last question I want to get to, and then we're probably out of time. But Mark asks if these programs are fully multilingual, that you just talked about.
That's a great question. They are. We have several different tailored programs as well to meet the needs of specific communities. So we also, in addition to being in different languages, we also have toolkits that are tailored for Hispanic or Latino communities. Obviously, those are both fully in English and in Spanish. They can also be translated into other languages on our site. We also have a toolkit for Indigenous communities. We have a toolkit for Black communities. And we have a few others that are in the works as well. So you can keep the lookout for those, and you can access that at lung.org as well. And I'm happy to send direct links to anyone that's interested. And it looks like my colleague, Michelle Mercure, is in the chat. She just dropped a link for all of our teen resources and resources for young folks not on tobacco in depth, which is a great alternative to suspension program specifically for schools to really educate students that might have been caught with one of these tobacco products to educate them rather than suspend them from their education.
Wonderful. Well, I think that's probably all the time we have, but thank you again, Rebecca, for sharing your expertise and for making yourself available. Thank you all for joining us today. And we do have a survey that we'd like you to fill out if you have an opportunity. We also have a conference that's coming up on November 17th on asthma and social determinants of health. It's an online event. Registration is open. It's free, and if you're looking for CEUs, and if you're a member, it is very cheap. So please go to chicagoasthma.org and go to events, and you'll be able to see the link to register for the CAC conference. And then, like I said, we'll put the survey in the chat, and I hope that you'll take it so that we can continue to provide resources and forums that are interesting to people and that give people the information that they want to know. So thank you again for attending today. And you can always email our association manager at info@chicagoasthma.org, and we will take your comments into consideration. So thanks very much, and have a great rest of your day.